Hello, everybody out there with type 1 diabetes. This is Dr. Jody Stanislaw, and today I'm going to expand on what we talked about yesterday, and that is how to avoid low blood sugars and what's the best way to treat them. So if you're just finding me, I have been coming live on Facebook almost every day, Monday through Friday, ever since lockdown happened at the end of March, because I'm here to inspire anybody that's struggling with type 1 diabetes. My passion is to help anybody struggling with type 1 have less highs and less lows and learn how to confidently live a healthy and vibrant life. So I've had type 1 for 40 years now, 40 years actually last Monday. And I'm on shots. I used to be on a pump, but I'm on shots. This is a little high to me right now. I had a little lunch that digested a little bit ago. And so after my video here today, I'm going to go for a bike ride because I'd rather be below 120. But that is my numbers. These are my numbers since last night. So not bad. So this is what's possible. Bike ride once I finish this video too, because I already have insulin on board. So I just need to kick it in to get that 139 to come back down. So low blood sugar levels, right? How do we avoid them? Well, this might be a radical thought, but the only reason why you have a low blood sugar is because of too much insulin. That's it. Okay? Exercise cannot cause a low blood sugar unless you have insulin in your body. So I grew up stuffing my face with food to avoid lows, and I didn't know this radical concept that I now love to teach you. And when we better understand when and how to dose our insulin properly, we can dramatically lower our chance of lows. So diabetes is not perfect. I never promise anybody we can never have a low again. But when you confidently understand how to dose your insulin properly, you can dramatically lower your risk of lows when you sleep, lows when you exercise, okay? Every single time you go low, it's because you have too much insulin in your body, and that's it, right? If you have a bunch of insulin on board and then you go exercise, you're gonna have massive lows. If you give yourself a huge shot at dinner and you didn't eat enough to match the dose, then you'll go low in the middle of the night. Right? Every low in the middle of the night is from too much insulin at dinner or your background or basal rate is too high. So when you properly dose your insulin, lows are still going to happen because insulin dosing is a is a definite challenge every single day. I make educated guesses every day. And when you dose your insulin, the more insulin you give, the more likely you'll go low. Right? The less insulin, the less low. That's why when I work with patients and what I teach in my online courses, the law of small numbers. I'm not a hardcore, strict diet person, but I do feel very confidently that when we eat whole food, that's the best way to take care of our body as opposed to processed food, and we mostly eat lower carb, our life's going to be easier. Right? The law of small numbers is you eat less carbs, you take smaller doses of insulin, and then you greatly reduce your risk of going high because you're not eating tons of carbs, and you greatly reduce your risk of going low because you're not taking tons of insulin. So yesterday someone said, if I eat one glucose tab, it raises me 20 points. I said yesterday when I eat one glucose tab, it raises me 15 points. Well, there's a lot of false precision in diabetes because there's so many variables going on all at the same time. If I eat one glucose tab on an empty stomach and I don't have a bunch of insulin on board working, then I could actually see how much it raises me. But if I eat one glucose tab and I still have tons of insulin working, which is pushing my number down, and I have tons of food digesting, which is pushing my numbers up, it's kind of hard to really see what one glucose tab does, right? If we want to make it mathematical, we can say that every carb, 1 gram, raises us about 4 points. That's kind of universal, but I hesitate to say anything in diabetes is universal. But if you're taking 1 gram of carb, it's gonna raise you maybe 4 or 5 points, right? So 4 grams in a glucose tab should raise you anywhere from 15 to 20 points, something like that. But somebody yesterday says, how do you sustain being up after you go low? Well, if somebody is staying low and then they're staying low and then they eat and they're low and they eat and they're low and they eat and they're low, that means you have way too much insulin on board, way too much, because the only reason why you keep going low is because there's still all this insulin that's working, right? So only reason why we go low is too much insulin. So if somebody's like, I'm low all night long, that tells me immediately they have too much basal or too much long acting. I had a patient once say, I have to eat every 2 hours all day long. And I said, you have way too much insulin in your body. I did a several day water fast once, and I didn't go low, right? Because I knew how to reduce my insulin enough to keep it steady. So if you are having lows a lot, you need to learn how to better dose your insulin. And my course, How to Get Off the Blood Sugar Roller Coaster, will help you, as will my course on nutrition and how to dose will help you. And my third foundational course of Mastering Your Blood Sugar with Exercise will help. So I don't want you to be scared of lows the rest of your life, right? I want you to be empowered with how to dose your insulin properly. And that's what my courses will give you. So if you're having to sustain not going low, meaning you have to eat more and eat more and eat more and eat more, that just means you have way too much insulin on board, right? All lows are not created equal, which is why all lows don't necessarily only need 15 grams of carb. The more insulin you have on board that's causing your low, the more carbs you'll have to eat. But if you barely have any insulin on board and you're 60, you might need half a tab or 1 tab, right? So we have to use logical, critical thinking when it comes to diabetes. All of these like set formulas, you gotta use your mind, because none of the set formulas actually generally work when we're in real life. When we have food digesting, when we maybe ate a lot of fat, or maybe we exercised all day, or maybe we're sick, or maybe we're PMSing, or maybe we didn't sleep, right? So we got to use critical thinking, and that's what my courses can really help you do. So go to my website, which is Dr. Jody ND, if you want to learn more, and I've got free videos and free handouts and all that stuff. The classes are under, if you click on T1D classes. And so I want you to feel confident that you can avoid your lows, and these courses will help you do that. So I'm going to go for my bike ride now. I want to get that back down to 120 or below. That's what I'm all about. We can live healthy and happy, vibrant lives. Please, what do you think? Did you like this video? Nobody's left a comment yet. What are you guys thinking? Leave a comment, say hello. Tell me what you want me to talk about tomorrow. Here I am, Dr. Jody. I'm a type 1. I help type 1s all around the world. My goal is to help all of us get a healthy A1C by being properly educated on making our own adjustments, right? Because our doctors can't manage our condition. We see them, 3-4 times a year. You've got to be confident enough to know how to make your own basal changes, dose changes, how to avoid your lows, how to avoid your highs. We've got to be honest, and we can do it. We can absolutely do it. My A1C has been around low 6s, high 5s. Sometimes I got a 5.2. Last one I think was 5.9. And it's not because I'm having lows all the time. It's because I know how to keep this tight range. And this is my passion, is to help you feel that confident. Because we know high blood sugar levels are damaging to the body, right? I even freak out sometimes when my feet feel weird. I've had diabetes for 40 years, and my eyes are good, my kidneys are good, and but it's inevitable that diabetes takes a toll on us year after year when we have highs. So we got to do all we can to take care of our blood sugar levels and exercise and eat healthy and stay fit. And that's what I'm all about. I'm here to inspire you that we can have a healthy life. You can have a healthy life. So if you need help, check out my website. I've got lots of tools and resources for you. And I've been doing these videos now. This is probably like my 60th or 70th one. You just scroll down on my Facebook page. There's tons of them. Lots of great tips. I've had patients say watching your videos has helped me more than going to my endo the past 10 years. So, which makes me happy. So that's my message for you today. I come live right around 3 o'clock Pacific, 6 o'clock Eastern. I don't know how many more weeks I'll be doing this, but this is my COVID special to you. So I'm glad you found me. Have a great day. Bye for now.